Hello friends, in this video we'll talk about the first three competencies of the male external genitalia. So we are in the male external genitalia series. We'll talk about testis, epididymis and the applied aspect. We'll see the features of the testis and epididymis together, then the coverings, the blood and lymph supply, then the descendant of testis and the applied aspect. Now let us see the external features. We can see now. This is the testis. This oval shaped structure. This is appendix, the anterior and the posterior borders. This is the head, body and tail, parts of the epididymis. Okay. And also here we are finding the ductus deferens. Okay. Now what are the coverings of the testis? We can see obviously external is the skin and three fascia, external and internal spermatic, between that the cremasteric fascia and the muscle. Okay, and inside we are observing the testicular vessels, the arteries and veins we are observing, and the layers, three layers are there. This one tunica vaginalis, albuginea and vasculosa. Vasculosa means there will be vessels. Okay, that is vasculosa. This is vasculosa. This is the albuginea and this is the vaginalis. Okay, this is the mediastinum of this. Okay, the sinus, the epididymis. Okay, this is the vas deferens and the vessels surrounding it. Okay. Now let us see the blood supply. The blood supply from the abdominal aorta, we are getting the testicular arteries that is passing through the inguinal canal and entering into the testis. Veins are very similar, but the vein is coming from IVC. IVC, okay, it's coming from IVC, which also has the renal veins. And here another important thing is the pampiniform plexus. We have the applied aspect associated with this. I will tell you, okay, in the future slides. The lymph supply, please remember only this, pre and para aortic lymph nodes. So remember the two P's, pre and para aortic lymph nodes. Okay. Let's see the descendant of the testis through these figures. Okay. So what is happening initially, this is how the peritoneum is. You are finding that the testis here, it is above, which is attached to the gubernaculum testis to the base of the scrotal sac. And slowly there is a formation of the processus vaginalis. And then what happens? Ductus deferens is coming and slowly the testis is coming down, forming the remains of that processus vaginalis. Also it is forming the three layers around the testis, and here we have the shortened gubernaculum testis. Okay, this is how it will be. Let's see the applied aspect. We have hydrocele and varicocele. Hydrocele, as you are seeing, there is a fluid in the tunica vaginalis. Just remember this much. Okay. Now varicocele. So varicocele is a clinical condition where the pampiniform plexus, triple P, pampiniform plexus. It looks like a bag of worms, okay, like that. This causes pain and atrophy of the testis. And how is the surgical approach? In the surgery, the pain is very common in the left testis, and the varicose veins will be removed in the surgery. Okay. So references from where I took the pictures. That brings us to end of the video. So thank you so much. I'll see you in the next video.